Hey, DNA. Thank you for listening to the latest episode of All Access DNA. I'm your host, Kate Wilson, and this is me begging you to fill out our listener survey at tinyurl.com/MR3KCM6B, or find the link in the show notes because that's probably easier. This helps us find topics that you are interested in and create new content, like our CEU Listen and Learn podcast package. On today's episode, we are talking to Maya Brown-Zimmerman, she, her, about living with Marfan syndrome. Maya is a cardiogenetic counselor who is passionate about making genetic information accessible. Let's get started. Thank you so much for being on the show, Maya.
Thank you for having me.
Let's start off by having you tell us a bit about yourself and your journey with Marfan syndrome.
So I was diagnosed with Marfan syndrome when I was 8 and genetically diagnosed when I was 20, I believe. Right now, I work as a genetic counselor, a cardiac genetic counselor, and I'm married with 4 kids, and we live in Kentucky.
Okay. And so you mentioned you kind of were diagnosed with Marfan syndrome initially, like I guess with a clinic presentation, but had a genetic confirmation a few years later. Tell us a bit more about when you first learned that you had Marfan syndrome and what led to the diagnosis.
Yeah, so my mom just kind of always felt that something wasn't quite right. I had been about 2 feet long when I was born. She was an off-Broadway dancer who was 5'3". My dad was not particularly tall. So having this very large child was odd. The doctor delivering me apparently looked at me and said, "Oh, you have a basketball player on your hands," which I think a lot of people with Marfan syndrome can relate being told something similar. But as I got older, I had multiple abdominal surgeries and I also had low tone. And so by the time I was 8, my mom said she just noticed that I couldn't do things that other kids could do. I was very clumsy, got tired out more easily. And so she went to my pediatrician and she said, "I'm not going to leave until you figure out what's going on." And I remember distinctly that he kind of just looked at me and then he went and got a tape measure and started measuring me. And then he looked at us and said, "I'm so sorry. I should have figured this out earlier. I think she has a condition called Marfan syndrome," and sent us to the hospital for an echocardiogram. And kind of things went from there.
Yeah, I mean, that's interesting that they were able to pick it up clinically or kind of get that diagnosis, because I know sometimes that can be a tricky sort of situation because there's certain criteria and things. And also, that's the power of moms to sit there and be like, I'm not leaving until we figure this out until you give me some answers. So you talked about like the abdominal surgeries, you talked about low muscle tone. What are other parts that are affected by the body, and what exactly is Marfan syndrome?
Yeah, and I will say those aren't classic symptoms either, especially not the abdominal surgeries. So we really kind of got lucky, I think, with the pediatrician noticing some of the signs. Marfan syndrome is a connective tissue condition, and connective tissue is like the glue that holds our body together. And so you can see differences with Marfan kind of throughout the body. So people tend to be tall as compared to like their other family members, long fingers, long face. We can see flat feet, curvature of the spine. The lenses in the eyes can be dislocated or the retinas can detach. And then we get concerned about the aorta, the main artery that runs from the heart. And that can become enlarged, develop an aneurysm, which is like a weak bulge in the artery, and that can tear. And aneurysms don't tend to have symptoms. And so you need imaging of the aorta to know if someone's aorta is enlarged. So that's what happened after the pediatrician noticed some of those signs in me. Went and had what we call an echocardiogram and then found that my aorta was enlarged.
Wow. Okay. So that was found, I think when you said 8?
8, yeah.
Yeah, 8.
So I was lucky to have an early diagnosis, particularly in the time before genetic testing.
Yeah. Yeah. And some of the measuring and stuff, like I was talking about with the criteria. So sometimes it's like these measurements that they take. And now there is genetic testing. So I guess if it were the case now, do you think the doctor would potentially just go ahead and order genetic testing or still refer you for the echocardiogram? How are people today that are suspected to have Marfan syndrome? Kind of what happens next?
A lot of times they're sending them to cardiology, sometimes in conjunction with genetics. Sometimes we get referrals that are coming in just to cardiology. I don't see many pediatricians that are ordering the genetic testing, but a large number of cardiologists are ordering genetic testing, and particularly if they don't have someone, at their hospital that does it, or genetics can do it. So as a genetic counselor, they'll see me in conjunction with one of our cardiologists typically. And the cardiologist will do the physical exam, and then I'll go over the family history and talk about the genetic aspect, and then do that test, which takes a few weeks to come back, which is much faster than it used to take.
Yeah, definitely. Well, and I'm curious about you mentioned it being so Marfan being a genetic condition, and sometimes it's inherited from mom or dad. Sometimes it's kind of new and it shows up new in that person. You mentioned, how your parents were not very tall. Again, not that everybody that has Marfan syndrome is tall, but was somebody else in your family have Marfan syndrome?
Not as far as we know, except for my son, who inherited it from me. At the time, they just kind of dismissed my parents as not having many symptoms or any symptoms. My mom eventually had genetic testing that was negative after I was an adult and had kids of my own. My dad passed away and never had testing, but he did not have like many outward features. So I suspect that I'm in the 25% that's de novo or new, not inherited.
And since you've been diagnosed, I mean, whether it was the time at 8 or having genetic testing to confirm that, what has your medical journey looked like? Because you mentioned having some medical procedures as a kiddo and then having that echocardiogram. What happened then after that finding on the echocardiogram?
So at the time, they didn't give me medicine. I don't think that it was as standard as it is now. It was the early 90s. But in that time period, the diagnosis came into question kind of again and again. After I went through a big growth spurt, the aorta kind of normalized. And so then it was, well, maybe you just have mass phenotype, which is what we used to call kind of having some of those skeletal features and nothing else. And then my senior year of high school, I had a cardiac ablation that resulted in multiple femoral artery aneurysms or pseudoaneurysms. Um, and so then they were saying, well, maybe it's VEDS, which is vascular Ehlers-Danlos syndrome, or Loeys Dietz had just started to be known about with the first couple of genes. And so I actually had genetic testing for VEDS initially, which at that point was a skin punch biopsy that was sent to Seattle and grown in a lab for 3 months. And when that was negative, then I had research testing for Loeys Dietz type 1 and 2 when that was negative. But then I was a sophomore, junior in college and said, let's just test for Marfan. Like, let's just see if that's what it is. And then that came back positive. But even since then, I had a coronary artery dissection and 3 vertebral artery dissections a few years ago. And so the geneticist that diagnosed me at 8 I ended up seeing her again in graduate school. And so she did like broader testing just to see if there was anything else in addition to Marfan that might have caused those dissections, because those are not common for Marfan. So it's been an interesting kind of diagnostic journey, even though the book ends Marfan for sure. We just didn't know for a while in between.
Right, and I find that that's so interesting because again, you were kind of growing up at the same time the genetic testing was getting more and more prevalent or having it. But so they were like, "Okay, clinical phenotype seems suggestive. We're finding stuff on echocardiogram." But even as you were getting older, there was back and forth and confusion about, is this really truly the diagnosis? And it sounds like even with the genetic testing, okay, yes, it is Marfan syndrome. There's still some things that you've experienced that are not typical or people don't
Yeah.
commonly see.
So maybe that there's some, as we start to look at modifier genes, which are genetic changes that on their own don't cause an issue, but in conjunction with other things do. I imagine at some point as we learn more about those, that I have some kind of modifier gene that's impacted the dissections that I've had and the abdominal surgeries. I've had multiple bowel resections for scarring, which is not, again, typical for Marfan, but guessing, connective tissue probably somehow related.
Right, right. So somehow kind of in the same area, but maybe not directly related. And so, like you said, with modifier genes, there's these genetic changes where they don't necessarily change how something works, but they impact another gene's job or how it makes another protein. Um, it's one of those things that uh, you do mention, like, having those dissections, but were they ones, like, that you knew were getting ready to happen, or they came on suddenly? Because especially if they're not ones that are common in Marfan, were they even monitoring you for some of those things?
No, with the SCAD and the spontaneous coronary artery dissection, we had just moved to a new city for me to start graduate school for genetic counseling. So it was like a week and a half before classes started. I was in bed reading a book and all of a sudden started having chest pain. And at first I thought, oh, it's just costochondritis, which is like a painful but harmful inflammation of the chest wall. And then I noticed that it was going up my jaw. and it was going down both
God.
arms. I thought, well, this sounds like a heart attack, but I'm 37 years old. Like, I shouldn't be having a heart attack. And I have an aortic aneurysm, but I shouldn't be dissecting like it's too small. So I kind of went back and forth for a couple hours until I really couldn't breathe. And then my husband was like, no, I'm calling the ambulance.
Yeah.
And even though they knew I had Marfan, they kind of dismissed the chest pain,
Hmm.
but my troponin levels were increasing. And so then they said, okay, well, we'll do an angiogram and see if we could find anything. The CT missed the dissection, but the angiogram picked it up. And then those tend to heal on their own. I had the first vertebral artery dissection in the hospital the day after the SCAD, but they didn't realize that's what was going on. And so they sent me home and it got picked up on imaging about 6 weeks later. And then I've had two more since then. And at least with those, that I recognized, oh, this is a similar headache. It's probably that, and just didn't go to the hospital because I'm on blood thinners and it's not like they were going to do anything. Picked up on imaging later, but probably didn't have an aneurysm. It was probably just a spontaneous dissection. That's what happens with scads typically.
Hmm. And is it something that you continually have to, like, remind your doctors about? Like, "Hey, I have this underlying condition," because, like, you were saying they were kind of like, "Meh, even though it's Marfan, maybe we're not
No,
paying full
I definitely
attention."
have to advocate. I had sudden onset upper back pain about a month ago that felt like the SCAD. And so I went to an emergency department and I told them that I had Marfan. And the emergency department doctor was like, well, I think your blood pressure would be higher if you were dissecting and you don't seem like you're in that much pain. I said, well, with my SCAD, the blood pressure was lower than it is now.
Hmm.
Like, trust that I know my body and please, like, do the CT and just make sure I'm not having another one. But it's just interesting to me that even though, like, I had the history and things, it still kind of, was dismissed.
And I would imagine that would be very, like, frustrating. Do you think there's things that people misunderstand about Marfans or something, again, like, I just don't understand why perhaps they weren't taking it more seriously or listening to you.
I think it's a spectrum. So, when you're studying it in med school or nursing school or whatever, like, you're taught about the more severe end of the spectrum. And so I think maybe sometimes they forget that it could present in different ways. And I do think my age throws people off. Dissections, maybe they're thinking are happening in older people, non-syndromic. But Marfan syndrome, you can dissect young.
Yeah.
So they need to know and rule it out.
And you've talked about, like, some of the medical things that you've encountered. You did mention that with Marfan, like, again, with, like, the low muscle tone, but also, like, getting tired easily. What does it look like day to day? So when fortunately you're not having to call the ambulance or go in for imaging, like, are there things that you've had to change in your lifestyle even because of some of the symptoms or things that can go along with Marfan?
Yeah, I mean, at this point in my life, chronic pain is like the biggest thing. And I have dural ectasia, which is essentially like an aneurysm of the dura sac, the sac of cerebral spinal fluid that protects the spinal cord. And about 60 to 70% of people with Marfan syndrome have dural ectasia, but not all know it because it can be asymptomatic or it can be very symptomatic. And I have quite a bit of pain from that. So I started using a walker 3 or 4 years ago to carry things, to use for distances. I sit on it in clinic. That's helped quite a bit. Um, it's hard to wrap my head around being in like my 30s and using a mobility device, but it does help. And then just pacing myself. So by the end of the day, I'm pretty worn out, but figuring out a way to make things easier so I still have time for all the things that I want to do and the energy for it.
Mhm.
And there are certain things around the house, like I pay my high schooler to scrub out the bathrooms because getting down on my knees to be able to do some of that just like isn't going to happen anymore.
Yeah, and I was gonna ask, like, how do you balance, or maybe balance isn't the right word, but how do you kind of navigate the fatigue, the pain, also being, a working mom, 4 kids, like, how are you able to navigate all of those things?
I have a husband who's very understanding and helpful. And so, we've had a shift in like household responsibilities and things, and that definitely helps. And then my kids have grown up being pretty self sufficient because if there's stuff that I can't do. And so we just kind of adapt. Like they're good days, we're out doing a lot, and then there are harder days when they know that I'm in pain and they'll, come to me rather than me going to them. I think it just looks different every day, but I'd rather suck all the life out of what I can do for as long as I can. So I just power through the pain as best as I can so that I can have all the experiences.
Yeah. Well, and I mean, I didn't even mention the fact that you went back go to graduate school also having, like, kids and all of this. So, I was gonna say, I feel like you must have quite a sense a drive or and a passion for the things that you're doing.
Yeah, I definitely love my job, love genetics, love working with the community, but just kind of have a passion for life in general.
One thing I did wanna ask about was with your son, because you mentioned that he also has Marfan syndrome. Was that something that you thought about before having kids or kind of while you were pregnant, and or was it something you weren't too concerned about?
No, my husband and I talked about it before getting engaged. We met with a genetic counselor because I knew it was a 50-50 chance of passing it on, but wanted him to have a chance to ask somebody who wasn't me questions and decide, you know, if that was something he wanted to move forward with and for us to understand what all the options are. Because there are different options. There's, IVF with prenatal genetic testing, and there's adoption and surrogacy and like all kinds of things. So we decided to just go ahead and roll the dice. I feel like even though I have Marfan syndrome, and it's made things harder than it would be otherwise. I feel like I still have a good life and have access to good health care. And so I was okay if we ended up having a child with Marfan, and my husband felt similarly. It is controversial within the community, which is why I'm glad that there are lots of options that exist. But, he said as there was a point in the pregnancy when I was feeling very anxious about it and like, am I ruining my kid's life? And that they're going to have a mom that's going to have less energy, that's going to have to do some things differently. Was it selfish that I'm having kids at all? And he was like, no, you guys deserve the same chance at happiness as everybody else. And our kids are going to learn to be resilient and self sufficient because we're going to be creative about things. So far, so good. They don't seem to resent any of that. And my son with Marfan is like proud of his diagnosis. And we've been lucky that he's never known a time when he wasn't surrounded by other people with Marfan because of our involvement with the community. He was like 6 months old at his first Marfan conference and has just kind of grown up with all these people, which is really neat. I know not everybody gets to do that. So I feel we're very lucky.
Yeah, I think that's really cool that he can have that community support, but also that he has a parent that's also going through this as well and knows what some of the pain and some of the fatigue can feel like.
I think it's a double-edged sword in that he's got me to advocate for him because I know what it's like. But, the night that I had my corner RJ section, he was still awake and he saw the ambulance coming. His siblings were in bed. And so I was trying to comfort him and downplay things as they're getting ready to take me away. But how can you not see that and then not worry about yourself and worry about your parent? During COVID, there was a lot of anxiety knowing that I have lung issues. And so if I got COVID, what was going to happen? And so he is exposed to that end of it too, which is a negative, but we deal with it.
Right, right. And then, like you said, you're involved with the Marfan community, Marfan Foundation, and so that there, I would imagine other folks his age too that may also have a parent that he can at least connect with, hopefully, and share some of the fears. Because, like you said, part of it, I think, is being able to at least have talk about it and not just withhold all of it inside.
Yeah, he definitely has made friends at the camp, at the conference, and now, they're just a cell phone text away. So that makes it much easier
Very
to connect
true.
with them.
I was gonna ask, what was it like during the pregnancy? Because I know even without having an underlying condition, during pregnancy, right, a woman's body is shifting, moving, changing, right, to keep up. Um, how was that for you being pregnant and having that on top of, um, the other things that were going on and the concerns for, I would say, like, for the heart, right, and the blood pumping through? Like, were there any things that had to be done, I would say, to manage or keep an eye on things related to the Marfan syndrome during pregnancy?
Yeah, so they recommend having echocardiograms, that ultrasound of the aorta, at least every trimester.
Okay.
So I kind of met with the maternal fetal medicine specialist, which is like a high risk OB, before I got pregnant because I needed to switch the medication I was on to be safe for pregnancy. And then seeing him more often, having the echocardiograms, kind of having like an emergency plan in place. With Julian, I started having contractions at like 24 weeks, but they weren't productive, thankfully, but it was painful. So there was bed rest involved, more imaging still. We had a really good team that was watching things closely, but you don't have, or at least I didn't have the element of choice. Like this is the MFM that does cardiac stuff. So this is who you're going to see. This is what the delivery plan is going to be. And then, so a little bit more complicated delivery for him than we had hoped. And so after all of that, we decided we weren't going to have any more biological children. And then we adopted two after him. But I was glad we had a good team that was communicating with each other through the whole process.
Yeah. Were you able I don't know if you were, like, in more of an urban setting or near, like, a university, like, was that kind of the team that you had? Because I know that's been challenges I've had with some of my friends is if they have a condition and are also pregnant, like you said, it's hard to find providers that specialize in that area.
Yeah, we kind of have always picked where we lived around being a university just because they tend to have more experience with Marfan and have like higher level for cardiac care or NICU care. But we were still a good hour in traffic away from the hospital. So my husband almost missed our son's delivery, but he made it in time, which was good.
And yeah, I would say that's gotta be challenging too when you're going in, especially for like pregnancy care, you're having to go in so many times for the checkups and like you mentioned some of the additional imaging. That makes sense in terms of like moving and where you're located. And so I guess that's been helpful to know, I guess having the diagnosis and trying to look for providers who have experience or who work in this space.
Yeah, I mean, so it was a big role for like where I was going to go to college. Like was did not go to smaller, more rural schools because I wanted to be easily accessible to a medical team and things.
Gotcha. And I wanted to talk about some of your work, prior to becoming a genetic counselor, then becoming a genetic counselor, because I curious to know like how much of your life with Marfan influenced, your decisions to go back to school and to work in the field of genetic counseling. You also had worked at the Aortopathy Foundation. And so I'm wondering if you can tell us a bit more. Maybe first let's talk about foundations and like the Aortopathy Foundation, Marfan Foundation. What kind of work do these foundations do?
Yeah, so I was kind of like a professional volunteer. Did a lot of work with the Marfan Foundation. I helped run their teen program for 10 years. So at the conference every year, it was like a long weekend. And so we had teens from all over the world and we figured out like what activities are we going to do with them, what workshops, help lead some of those educational workshops. And then outside of conference kind of kept it going, with Skype or Zoom, email lists, like ways to connect, which is much easier now than it was back then. Have also helped lead support groups, done educational webinars kind of like in the off time, and kind of went around the country giving talks about being a patient with a rare condition, accessing care, kind of those barriers and things. Talked about that with hospital systems, ways that we can make that better. And that I felt like kind of naturally led into then going back to school to be a genetic counselor. Because one of the things that I do is run the largest Facebook group for people with aortopathies and would just see how often genetic questions came up, how to access care, how to interpret results. And so I was answering a lot of those questions and realized I should just go back to school and do this. Um,
Mhm.
so definitely the experiences that I've had within the community played a role in my decision to come.
Guess kind of what was maybe your experience going from like a patient to a provider? Was there some things that you didn't anticipate in terms of, what that transition might be like?
Think that it was too difficult. I think, it's interesting seeing kind of the flip side, like the amount of time that's spent on admin work, and how that then plays into like how long it takes for patients to get results. That there's a lot that goes on that like we as patients don't see, which has been interesting to learn about and now be handling. But I hope that it makes me a better provider, having an understanding of all the different kind of barriers that there are to care, the distance, health literacy, financial, just having the energy. It's a lot to make these appointments, anticipate these appointments, go and get potentially bad news, And then if you've got kids that are affected, times however many children. So I hope that helps me to be more empathetic with my patients and creative about kind of thinking of solutions or knowing what questions to ask to discuss, how they're coping with their diagnosis.
Do you often disclose that you have a diagnosis? Because I know in the genetic counseling field, we talk about self-disclosures, and sometimes we might have things that we're facing that are very similar to what our patients are facing. But sometimes there's times where we choose to put it out there and choose not to.
Sometimes, I do. Sometimes I don't have the choice because I'm very active within the national community. So there have definitely been times when I've come in the room and my patients know who I am and have like brought it up themselves.
Mhm,
If I feel like it's going to be helpful to the patient in the moment, then I'll disclose. And if I don't think it's going to add anything to the visit or what they need, then I don't say anything.
mhm.
So I'm more likely to disclose with my younger patients that, talk about they haven't met anybody else with Marfan. And then I can say, well, I actually have it too. And so, that opens the door to some conversations. And I think it's important for kids with Marfan to be able to envision themselves in a lot of different occupations. And so having a provider who has this allows for them to kind of uh, see that that's a possibility for them too. So I think as a teenager going to the conference, that was very valuable for me was seeing adults who were living well because it was hard to envision for myself what I couldn't see. And that made me much more optimistic about the future.
And that's what I was gonna ask too is, like, being a patient, a parent, and a provider, what are, like, some of the resources that you recommend to your patients or to their kiddos, in terms of learning more, but also finding these resources and support?
So I make sure to talk about whatever nonprofit organizations that I can find for their condition. So for patients with Marfan, we talk about the Marfan Foundation, and I have like a little packet that'll say like, here's are some different support groups they offer, or they have a teen program, they have a kids program that are virtual, so I give them information on those. They have, Loeys Dietz or VEDS. I'm providing information on those conditions, or I see other cardiac things too. But we talk about the value in connecting with people that have the same diagnosis, but also that there's a downside because you get to know each other. You're going to be, potentially affected by negative things that may happen to them. And so there's a risk, vicarious trauma and things in participating in those groups. So we discuss kind of both sides so that people can decide, if they feel like they're ready to jump into that yet. I know that it's okay to take a break if it, feels like it's too much.
That's a really important part I hadn't thought of, and it kinda brings back to mind, like, what you were talking about with your son, seeing you go in the ambulance, like, seeing these things and worrying about the other person, but then also worrying, "Is this gonna happen to me, or am I gonna have to go through something like that?" And so I imagine that it helps for them to hear that it's okay to take a break, and it's okay to take care of themselves and still be concerned about their friends, but yeah, that's a viewpoint I had not imagined.
I talk about it with my providers too, because I'm not immune to it. I mean, I've been in the community for over 20 years. I've lost a lot of friends. This is a condition that we say is very manageable. It has an average life expectancy if you're diagnosed and doing what you need to do, but it doesn't change the fact that over the years I've lost a lot of people. And so that, impacts my parenting. It impacts how I approach things. So yeah, I have all the data. I have the information as a provider, but then there's still the emotional aspect too that comes out. And so I think I acknowledge that with my patients, but also like as a patient myself, have those conversations with my doctors.
One of the things that you had mentioned in talking about kind of this community is that there is this overlap between connective tissue disorders and cardiology, but also like VEDS, Marfan, Lois Dietz. What do you see happening in this space, I guess, in terms of like patient advocacy and some of the work that you do with the foundations? Because one thing that I've just noticed as an outsider is it seems that there are specific foundations for specific conditions, but also there seems to be foundations where it's kind of overlapping.
I think we're going to see more and more of the overlap. So the Loeys Dietz Foundation and the VEDS movement are now under the umbrella of the Marfan Foundation. So they have their own directors, but it's all one umbrella organization. So we'll have one conference for everybody, but there'll be different tracks so that you can, if you have Loeys Dietz, go to the Loeys Dietz track where they'll have workshops that are like specific medically to the differences, because there are differences between those three, Marfan, Loeys Dietz, and VEDS. But then there'll be workshops. I'm going to be co-doing one at this year's conference on family relationships. that's really applicable to whatever diagnosis you have. And research wise, it behooves us to work together because a lot of the science is going to be applicable across conditions. And so if we can show that we're working together, it's going to be easier to get funds for that can be used for multiple rare diseases rather than just for one.
That makes sense. One question I was wondering too is like if we have somebody who's listening who was recently diagnosed or has a loved one that was recently diagnosed, what have you found that has helped you cope with uncertainty or health related anxiety? Or maybe what do you tell your son when you notice that he might be struggling with that?
I try to look at it like logically and look at the data because I've got like the science mind.
Hmm.
But I think therapy is good for everybody, regardless of like if you have a chronic condition. So I always recommend considering that. And then for me, having friends in the community online has been really helpful so that when I'm having a hard day, I can text one of my friends and they can do the same for me. And just having someone else who's like, yeah, I feel that way too, but you know what? We're still here. We're still trucking along. Like just that reinforcement is very, very helpful.
And if somebody who's listening wants to learn more about either Marfan Foundation or Connective Tissue Foundations, is there like a website or a community that you would point them to start out at?
Marfan.org, Marfan.org. We'll take you to the Marfan Foundation and you can get to like the Lowy Seats and Beds Foundations from there. I think that's a great place to start. The information's easy to understand. They have, clearly laid out sections for all the different conditions or body parts. And you can find out information about connecting with people in the calendar, which I think is like in the upper right-hand corner of the website. On Facebook, the group that I run is just called Marfan Syndrome. And there's about 18,000 people from around the world with Marfan and related conditions that have joined. And it's a good place to be able to talk with other people, meet other people.
And we'll put all that too in the show notes too, so people can find the links there to get plugged in. Is there anything that we haven't covered, about your story or Marfan connective tissue conditions in general that you want to make sure that people are aware of?
If people are looking for a diagnosis, you don't have to see a geneticist. You could see a genetic counselor, and you can go to findageneticcounselor.nsgc.org to find one near you. They have like a telehealth button. You can search by telehealth even, but I would not use direct to consumer genetic testing as a way to diagnose yourself. Get clinically ordered testing through some kind of doctor, nurse practitioner, genetic counselor, somebody, and go from there.
Yeah, I think that's a very important point, and we'll put some information about that too in the show notes because we've done a couple of interviews where we talk about why the direct to consumer offerings are not necessarily going to include all the things that a medical grade type of test will, but also that they may not analyze the data that they do analyze in the same way as a medical grade type of test.
Definitely.
Thank you so much, Maya, for being here today and for sharing all of this with us.
Thank you for having me.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening and join us next time.